Hey guys, this is Celia Andrio, and for my public service announcement project, I chose FNEP, that is the Expanded Food and Nutrition Education Program. I selected this program because during my undergrad at Mississippi State, I worked with the MSU Extension Services, and my boss was a program coordinator for FNEP. Now I help with Dr. Shelnutt's research here. She's the PI for FNEP through UF IFAS Extension. So all I generally see is my tiny role in coordinating projects or entering survey data. But in undergrad and even now, I don't think I fully grasped what the program had to offer. So I just wanted to take this opportunity to become more familiar with the logistics that I don't see on a daily basis. So to get started, this is sort of just a big picture overview. FNEP is the nation's first government-funded nutrition education program, so it's part of the extension system, meaning that it is solely implemented by land-grant universities, and it actually began as a pilot project in Alabama when the USDA was seeking to find solutions to concerns of poverty and hunger. So that's super interesting. It operates in all 50 states and territories. Collectively, it does consist of 76 land-grant universities, but I'll be focusing specifically on Florida as a state program. So FNEP does train staff to go into the communities and educate on nutrition or physical activity to the low-income population, mostly for families with young children. So the approach they use is a community-based relationship aspect of hands-on learning in order to improve the health disparities that we see. So FNEP's mission is to assist, like I said, these low-income families in acquiring the knowledge that they need to make behavior change. Most of that behavior change is related to dietary intake, and that would be formulated by the dietary guidelines and MyPlate, educational tools like that. So things like helping parents and children learn how to eat healthier meals and snacks, or just stretch food dollars. Also things like reducing the risk of foodborne illnesses by learning food safety, storage, preparation techniques, things like that. So all of this is with the goal or the purpose of increasing the impact of nutrition education just by reducing that prevalence of obesity and chronic disease. So our target population, again, are the limited resource families with young children, all of whom should be eligible for public assistance to qualify for the program. So this can also be a grandparent or a non-custodial parent as long as those individuals meet the income guidelines, and they also must be responsible for, in some aspect, planning, shopping, and preparing the food preparation for children that they take care of. But this also would service parenting teens or pregnant women, young children, or families with school-age youth. So next we're going to talk about funding. So FNEP is funded by NIFA under the USDA. So that stands for the National Institute of Food and Agriculture. And in fiscal year 2018, there was $67.9 million appropriated for extension partners to use to conduct FNEP programming. The FNEP funds are administered as formula grant opportunities, which means that grant approval, it's contingent upon several things, some of which being like a 5-year plan or an annual update. Also things like budget sheets, budget justification, submission of just annual program data. So there are things that states need to do to procure that funding and those grants. Additionally, states could also seek support outside of what's allotted from the federal government, and that can come through donations or other resources, things like building spaces or educational supplies, ingredients, or just even assistance from volunteers can help FNEP run just daily operations. So as far as the educational structure of FNEP being implemented into communities, there are extension professionals who train and supervise peer educators, and then those peer educators then go into the communities to educate the program participants. Volunteers also can assist with that delivery. And then the delivery itself consists of 5 core educational concepts that are taught through a series of lessons that can be delivered in group settings or one-on-one settings. And the whole idea there is just that there's an active involvement piece and that participants have time to apply the concept that's being taught in order to elicit behavior change. So as a reminder, again, those core areas are nutrition education, through diet quality, physical activity, food resource management, household food safety, and food security. And lastly, the outcomes that FNEP seeks to elicit are just collaboration with community partners that would hopefully strengthen the available support systems to individuals in the community. Also, networking can help increase the program's reach. And then when participants experience success in the program, the thought is that they would then contribute back to the communities in which they live. So the community is ultimately being benefited in the end. All right, so as we were talking about the peer educators, to be a peer educator, those qualifications are listed here. Individuals must have a GED or a high school diploma. However, additional education on top of this is not necessarily considered a benefit because the following bullet points right here, the qualitative characteristics or even just their ability to interact with individuals is much more important. So this could be things like just being a member in the community that they support, being skilled in delivering a lesson, being committed to providing good instruction, being an influential person, or just being dedicated to reaching this diverse low-income population. So as I previously stated, these peer educators are trained, supervised, and supported by university staff and professionals who generally have that programmatic expertise or knowledge in the field. So they could be a dietitian or another practitioner, maybe a PhD student or an MPH graduate, things like that, typically. Okay, so taking a look at the program reach, this is all for 2018, and FNEP serviced roughly 90,325 low-income individuals and 345,000 low-income youth that year. They also FNEP as an organization employed 1,822 educators. So it's a huge program, and it services both rural and urban communities, reaching a 72% minority participant base. So also in Florida, FNEP has been administered historically through the University of Florida and Florida A&M University. That's for 40 plus years. So in the next few slides, I'm going to be focusing on the curriculum that's pertinent to our area specifically. Yes, so locally, FNEP has been administered through UF services, and that's to 6 counties, with the main FNEP state office being located here in Gainesville. The principal investigator, as I mentioned before, is Dr. Carla Shelnut, but there's also underneath her a program coordinator, education and training specialist, and office assistant, data manager, several positions like that. And also I've included here a list of community partnerships. So as you can see, FNEP affiliates with organizations like SNAP, WIC, Head Start, but also they affiliate with churches, schools, and libraries. So there is a huge base of interaction here that FNEP is benefiting from in the community. So specific to FNEP programming in Florida, there are 2 sets of curriculum, one for adults and one for youth. I'm going to touch on a few highlights from each of these. So for adults, the curriculum that's currently being used is the Eating Smart, Being Active. And it's widely used. It's a validated educational tool, and it consists of 9 60 to 90 minute sessions that cover information from the 2015 to 2020 dietary guidelines. There's also additionally a session for pregnant women or new moms, and that session meets for 3 extra lessons. So at the end of these lessons, there's always some sort of interactive activity that's incorporated. As I've listed here, that's things like food demonstrations or physical activity component. And then in comparison, youth also receive an evidence-based educational curriculum, but it's often distributed and taught in schools where most students are receiving a reduced lunch. So any Title I school in those counties that I previously listed where at least 50% or more of the students are receiving free or reduced meals. Also, lessons for youth are only about an hour long, and there are 6 of them. Okay, so here is the outcome data from FNEP programming in the state of Florida from 2018. So as you can see up top, on the top left, there were about 10,000 graduates of the educational series this past year, and that's youth and adult combined, which is huge. We also see major reported improvements in food choices, physical activity, the management of food resources, and I'm about to go into limitations of the program. But the first thing I did want to note is that I think it's a huge strength that FNEP is able to gather this kind of data, and that FNEP does engage the community in the way that it does and is sort of affiliated with the number of partnerships that it has. It really is a resourceful program, in my opinion, and we do see great outcomes here. But some potential limitations and things that I think are important to recognize. We know that research does help maintain the programmatic effectiveness of FNEP and just its relevance to be able to inform the program's direction in the future and to make FNEP a strong evidence-based foundation. But with that being said, there's always, limitations of the data that's gathered. So FNEP is a nationwide program, and with many paraprofessionals teaching the curricula in different states, of course, the training and the experience of those educators is going to be hugely variable. So yes, the effectiveness of training and the implementation that those paraprofessionals give would vary from state to state. Also, it's important to consider that the self-reported data always has a risk of bias. So some measures of program effectiveness do rely on that self-reported participant data, which I think is a limitation. The program is time-consuming. As we saw, there are several sessions that meet consecutively week to week or month to month for at least an hour at a time. So it could be a commitment for busy families. Also, in my opinion, this is strictly an educational program, so quantitative data is not gathered. It's usually just knowledge and behavior change that's reported. So in my opinion, seeing an impact on things like lipid biomarkers or the prevalence of obesity among individuals that graduate the program would be super cool. Although we would expect that if those behavior changes are occurring, knowledge is taking place, we'd expect for obesity and other biomarkers to fall in line behind that. So here are my references, and that was my take on the FNEP program. I hope you guys have enjoyed this, and thank you so much for listening.